everyone. I am Dr. Esha Shanbhag, Gynaecological Oncologist at Aster International Institute of Oncology, Whitefield, Bangalore. Today we'll be talking about pap smear. You would have heard during your routine health checkup, doctor advising you for a pap smear. What is it? Why do you have to get it done? Pap smear is a very simple screening test which is done on an outpatient basis. Here there's no need of anesthesia, there's no admissions required. We just scrape the cells from the cervix. Cervix is the lowermost part of the uterus or our womb, and we prepare a smear and send it to the lab. And the reports range from being normal, which is very good. It can be inflammatory, where you'll be prescribed medications to get it treated. But the most important reason why we do a pap smear is to detect cervical cancer and the precancerous lesion. So this is one of the earliest opportunity for us to detect this cancer when a woman doesn't have any symptoms. So why do we have to do a cervical screening? Cervical screening is a very common cancer affecting Indian women, and it's a leading cause of death. Second is, the most important fact is we know the exact cause of the cervical cancer. Almost all of these cervical cancers are linked to an infection called the HPV or the human papilloma virus. All the women in their reproductive age group can get infected with this HPV, and if persistent can cause cervical cancer. So we can detect these abnormalities, treat it at the earliest, and prevent the cervical cancer from happening. Third is because the cervix is a very easily accessible organ just from the vagina during a routine gynecological examination. So these are the main reasons why we have to go for a cervical screening. So who should go for a cervical screening? All the women beyond 25 years of age, once they're sexually active, have to have a cervical screening up till they are 65 years of age. So how frequently should we get it done? So that depends upon what modality you're using for a cervical screening. Like I said earlier, it can be a pap smear. Pap smear, if done and reported to be normal, the screening has to be done once in 3 years. But the most preferred modality is pap smear in clubbing it with a HPV testing. And if that reported to be normal, we can go for a screening once in every 5 years. So based upon these results of screening, your gynecologist might advise you for a colposcopy. So colposcopy is nothing but a magnification. We examine the cervix under magnification, and if we find any abnormality, we take sample of tissues and send it to the lab. So we at Aster Whitefield Hospital provide facilities of the cervical screening with this combined with HPV. We offer you colposcopy, and there are also higher advanced technologies for the treatment of precancerous and the cervical cancer lesions. So to conclude, all the women in their reproductive age group have to have a cervical screening done to stay happy and stay healthy. And if any further queries, please come back to us.